Standing by in Studio 61.
Yes, it is time for our Health Watch with our friend Dr. Syed Hussain of Trinity Health of New England. Welcome back.
Thank you.
So we have quite a few topics to get into this morning. First up, a big bombshell. Deion Sanders this week announced that he was recently diagnosed with bladder cancer, an aggressive form of bladder cancer, and he says he has beat the cancer, but they had to remove the organ. So what should people know, particularly men, about bladder cancer?
Sure. First of all, I'm happy the coach is on the road to recovery symphony. Now, this is the fourth most common cause of cancer in men. And it's not a surprise, but the leading cause is smoking. So if you're a smoker, look at ways to reduce smoking and eventually quit smoking. But some of the warning signs or red flags that men need to look out for include blood and urine. Absent an infection, blood and urine is never normal. And you need to get checked out. You need to go to a doctor, your primary care physician. The other symptoms, less common, include weight loss, loss of appetite. There may be some dull pain, lower back pain, nocturia, which is or frequency in urination, nighttime urination frequency. That increases urgency to urinate. All of these symptoms put together could be, signs that you need to schedule a follow-up appointment. What this does remind me of, though, is what we saw a few years ago. I believe it was 5 years ago. The actor Chadwick Boseman,
yes,
43 years old, who died of colon cancer, advanced colon cancer. Again, going back to how that annual checkup with your primary care provider is so important.
Yes. Okay. Now, our next topic, it's about, people healing. Speaking of death, it's difficult for folks to get through, right? Is it true that people can actually die from a broken heart?
So this is a large study that was done in Denmark, about 1,700 people, followed up for 10 years. Different groups within this study, so folks that had really a hard time dealing with the loss of a loved one versus those that had coped and had coping mechanisms that had better support structure, for instance. Those folks did better. The individuals that had more grief, and there was a questionnaire that folks had to fill out at periodic intervals, they actually didn't make it through the 10 years. There is another known condition, Symphony, in medicine known as Takotsubo cardiomyopathy, which is broken heart syndrome. That's more acute, though. This was more prolonged, long-term. Takotsubo can happen in people who experience acute stress, physical or emotional stress, that damages the heart, can lead to heart failure, and can mimic a heart attack. But long story short, yes. And what can we do is to support our loved ones when they are grieving. Look for those signs. Are they having a hard time? Are they losing interest in the activities that interested them prior to this tragic episode? Things like that, so that we can wrap our arms around them and provide that support.
Yes, yes. Okay, we have one more. There's a new study out doing some research on a pill that could make our blood deadly to mosquitoes.
So this is interesting. This follows on a number of other research studies that have been done over the years, but this looked at a very large study that looked at areas where there's a high prevalence of malaria. So this was centered in Kenya, a large randomized control trial in the season where you would see malaria. And there was a 26% decrease in the incidence of folks contracting malaria if they got this pill once a month for 3 months. So very promising, and maybe a tool that may be deployed in areas where there's so much malaria. Remember, in 2022, there were over 260 million cases worldwide of malaria with a large number of deaths too. So this can be a promising tool to fight this disease.
Yes, and not necessarily just for us everyday folks here getting regular mosquito bites.
That's right. Thanks for clarifying.
Thank you so much for joining us this morning, Doc.